Let me begin by saying, it's interesting that much of what we're going to be talking about today affects such large-scale populations. But in my world, I'm the president of Sentara Life Care. I'm actually one of the operating entities within Sentara Healthcare. And even though we're a company that has a long, rich history as a nonprofit, and we're a little over 120 years old, I actually focus on many people, but I also focus on the few. Each day, my group serves about 1,000 people in various domains within Sentara. We're happy to have a local hospital here in Williamsburg Community Regional Medical Center, for which I operate a rehab unit within the hospital, but also serve long-term care needs. We have skilled rehab facilities around the eastern part of Virginia. And we also have a small managed care organization. I actually manage a small Medicare HMO that serves just targeted seniors. It's actually called PACE, as the acronym, Program of All-Inclusive Care for the Elderly. And what we're really trying to do is keep people healthy and independent in the community. And so to me, that's an amazingly rewarding opportunity to do that for seniors so that they don't have to be institutionalized. So while I actually have classic nursing homes around the area, certainly my goal is to keep people at home and independent. Okay. Well, let's see. Can I give you my? There you go. Great. Okay. Would also say, just in some of the, what I want to do today is talk to you about some of the areas where we actually use social entrepreneurship within Sentara, and then maybe take a few minutes and talk to you about some of the future opportunities. One of the things we do today, even though Sentara's network of 10 hospitals, we have a large managed care organization as well as, great. All right. Thank you. Okay. Try that. Great. So you can see as part of our network, we have a wide array of services, 3,400 medical staff, close to 400 of which are actually employees of the system. We also have a 400,000 member health insurance company that in Virginia also serves a large Medicaid population. We also have a College of Health Sciences. We offer bachelor's degrees in nursing, but then in general, our footprint is about a $5 billion a year revenue generating entity, and with assets nearing that. We've also been recognized nationally for a number of years for being one of the most integrated delivery systems in the country, so we're real proud of that. So just a quick underscore of how our network is laid out. Everything from health insurance to primary care services, pharmacies, mental health care, urgent care, up to hospitals, including long-term care and end-of-life care. A lot of my responsibility takes me in a variety of these different areas. And simply our mission for Sentara is we improve health every day. We really do try to keep it simple. And we do have a strategic plan that's really premised on focusing on growth, really trying to be the best of breed, top 10 performance, but really we spend more time around transformation of care. About 3 years ago, we spent some time with Johnson & Johnson to talk about how we could really rethink how we can perform care in much more innovative ways. So just, again, for those who may be outside the area of Virginia, this is just generally our footprint around the tri-state area. So what are some of the things that we're doing in action around social entrepreneurship in Sentara? As you see from the definition, which I pulled also from Wikipedia, I think the piece that stands out most for me is this really the social venturing. The reality is for us at Sentara, I feel like we've always been entrepreneurial in our way, in our manner. But I think one of the things that I'm discovering more so is the need for interdependence and working with others so we can have collaboration around innovative solutions. I'd be remiss if I didn't at least comment. We spend a lot of energy being active on the internet. Obviously, the internet is only but one tool in the toolbox of how to be socially responsible. But we're active on Twitter. We also have a Facebook page. We're also active on YouTube. But I think one of the things for me that's most exciting in my world, Sentara has lots of different legs to it. But I think in my world, I just want to share with you a couple of the items I'm working on. A couple of the entities: Eastern Virginia Medical School, the Colonial Heritage Community Foundation, which is a local foundation here in Williamsburg, Older Dominion Partnership, and FREE, which is the foundation for rehabilitation, for equipment endowment. So let me just talk briefly about the Colonial Heritage Foundation. About a year ago, I picked up the Virginia Gazette, and I noticed that the Heritage Foundation was interested in bringing adult day services to the community of Williamsburg. I called Joan Bender, who's the CEO of that, and I said, "Is there a way for us to really collaborate? Let's socially get together and make sure we can do something from this community." And I think that's moved now in the direction of we're probably going to introduce a daycare model within the next probably 8 to 10 months. We're also trying to collaborate with the YMCA so that the hope is that we can have intergenerational services for seniors within a YMCA environment. So we're pretty excited about that option. Another is the FREE Foundation. We actually have a nurse that started this. She was working in our emergency department at Norfolk General Hospital, where she felt as though there were patients having to leave the hospital that needed wheelchairs or walkers for which they couldn't afford it. And so she took it upon herself to bring members of the community together that would donate these things, and she started filling up a garage full of wheelchairs and walkers. And as she was doing this, she also found that there's somebody in Roanoke doing the same thing. There's a gentleman from Roanoke actually started what's called the FREE Foundation. It's now become a statewide network of a collaborative where people, and Sentara is now supporting this, where we bring supplies together so that people that can't afford them can get them post-hospitalization. Sentara Rx is actually one of the entities that I do provide leadership. It's a long-term care pharmacy, and we serve probably about 1,500 people a day with medications in various different domains. But one of the things that we've found is as people transition out of our environments, a lot of times we have medications that we essentially have to throw away. And clearly we're being socially responsible by not throwing it in the trash cans. We actually are careful about how we dispose of it. But what we found is there are people that really need these meds. And what we've done is we've now worked with Physicians for Peace, but we also donate them to other causes in South America. So we make sure some of these developing countries that need medications, we can actually do that. And each year we give it around $600,000 away in medications, which is material. One of the other things is that Eastern Virginia Medical School is a local medical school in Norfolk, and for years we've worked sort of independently as siloed efforts. The medical school has just really started a state-of-the-art simulation center, and so we're real excited to see them do that. But it's something that we don't do well, and so we're partnering together to make sure we have have a lot of our clinicians and staff trained properly, and so we're excited about that. So when we just think about some of the future things, and I think for some of your roundtable discussions, I'll sort of tee up some discussion points. One is there's John Martin, a number of years ago, wrote a book called Boomer Consumer. He lives in Richmond, market research and background, and his whole point was with the growing boomer population, there's going to be a real need and a growing need, and the first set of boomers have already turned 65. So over the next 17, 18 years, our communities are going to be stressed with how do we provide services to boomers, either through housing or through transportation, but of course in my backyard, healthcare. That's one of the things that we're spending a lot of energy on. And so in my role in working with aging adults, that's one of my key areas. But it becomes one of those things where even though you may have health systems working on this, it's really an opportunity for true citizenship. I think I heard that Andy used that term earlier. This is an opportunity for any of us to really work together in our communities and try to build designs so that truly we're prepared. If we look to our government to give us the answers, we're going to be probably woefully underserved. We do have a responsibility to do that. that. And what John Martin has done has really gotten these efforts started, and really in earnest in Richmond and Charlottesville. We've actually started in the Hampton Roads area, Eastern Virginia. So we're really excited about that, and we're starting to work with Cox Communications and some of the various entities in the community to try to get that started. So that's an area that you personally can have an impact, and it's maybe not just in the Older Dominion Partnership, but in any of your states. This is really an opportunity. The other thing, and I'll just take a couple of minutes, Medicare, at the federal level, Medicare really is trying to encourage more collaboration across the network, and I'll just list 4 of them. They're really trying to seek public-private partnerships in the management of primary care. Independence for Home is yet another. Care transitions is another exciting one that we're starting to put some energy into, because hospitals in general aren't really responsible to manage people's care once they get back to the community. Our goal really is to try to reconnect them with primary care, but a lot of the times that's fragmented, and it results in a lot of unnecessary rehospitalizations, and so we're trying to partner with other communities to solve that. The last one I'll just comment on, and it's one of the things I'm spending a great deal of energy on, and I think others really, we really should as a society pay attention to this. States really are encouraged to work on integrating Medicare and Medicaid financing. So what's that really mean? Probably not surprising to you, GDP for the U.S. Is significant around what we spend on healthcare. If you look around the world, you can't really see it clearly on here, but this band of countries below, we're way out ahead, closer to 17% GDP, and certainly on the average per capita spend is much higher in the U.S. than any other nation. If you look at overall GDP, clearly it's the highest of any other spend within the United States, and it's a growing issue. The other thing, as we talk about healthcare reform, yes, healthcare reform is in ensuring that everyone has access to care, but one of the issues is really more so trying to control the spend. So while there's 48 million Americans that are currently uninsured, that number is in fact growing. But the real issue is trying to bend the curve and reduce the rate of annual growth on the spend of healthcare expenses. Interestingly, if you look through the history of spend, even from the beginning of the Medicare program, it does, as Congress threatens decreases in spend, usually the market reacts to that. But the history would suggest that as the market reacts to that, usually there's an increase subsequent to that. So we're entering a phase now where we're hoping for healthcare reform to really help reduce expenses, but in reality, there's the potential for that to grow again. And I guess the case in point I have is if you look in Virginia, and this is true in any state, but if you look for Virginia specifically, we spend about $6 billion over a biennium on Medicaid expenditures, and that supports about 800,000 people in the state of Virginia. It's grown from below $2 billion in the mid-'90s to well over $6 billion now. So is this unique to Virginia? No, it's true and going on in every state. Healthcare reform will allow more people to get access. In Virginia, that number is about 300,000 more. If we're at 800,000, it's going to grow to over 1 million people. The interesting piece about this, and this is where we talk about the few as opposed to the many. If you look at this slide here, you'll see, and it's almost like a classic Pareto discussion where about close to 80% of the people who are children and adults actually consume, to the right, about 30% of the expenditure. And so managed care, by and large, in many states, plus Virginia, have done a good job of bending the curve on how you put expenditures to regular adults and children. But if you look at the smaller population, the aged, blind, and disabled, and that disabled population is folks with cerebral palsy, folks with Down syndrome, they're consuming 2/3 of the expense. That's $6 billion. 2/3 of that $6 billion is going to a small population, which says to us we need to do a better job of managing that population. So I guess I'll close with, it's about population health management. If you look at that population I just talked about, across the country, there's a large segment of folks called the dually eligible, those that are both on Medicare and Medicaid. It's about 9 million people. So we have a responsibility to try to figure out better ways to manage their care. In Virginia, that number is about 75,000. So in my backyard, my job and role is to try to figure out a way to help them. That's not going to be, even for a company the size of Centerra, we're not going to be able to do that alone. We're going to need to be partnering with various communities, and whether it's a Colonial Heritage Foundation that provides adult day services or area agencies on aging. We've already started having dialogue. We need to be able to manage and provide care coordination to the folks we serve in the community. So with that, I'm going to leave that and offer it up for more discussion. Thank you.